Well, welcome to the University of Nebraska-Lincoln campus this morning and to what's a very exciting day for us here at the University of Nebraska. Who would have ever known that the NCAA would know how important this event was today? For us to be celebrating a new partnership that we could not be more excited about between UNL and the University of Nebraska Medical Center. We are very pleased today to be celebrating the groundbreaking, and I think you're probably pleased with me that we're doing it here rather than on the site on this crisp morning, of a new 107,000 square foot joint UNL Student Health Center and UNMC's Lincoln Division of the College of Nursing facility on the Antelope Parkway here just to our east and a little bit north. This facility will be roughly half of the footprint of that building for each of those two important functions for the university. That will replace our current UNL Health Center on Vine Street. Also will consolidate our psychological counseling services into our Student Health Center unit that is now being operated jointly with Nebraska Medicine as a new partnership since July the 1st. Before we have several folks come and tell you a little bit more about the facility and about how excited we are about its development, I just want to point out a few folks that we're very pleased to have with us here for the celebration this morning. We have several members of our Board of Regents for the University of Nebraska who are joining us. I saw Bob Whitehouse, incoming chair of our board here, Tim Clare back here in the back, and Jim Pillen. Thank you for being here this morning and for your service to the university and the state. We also have with us Spencer Hartman. Spencer representing the students of the University of Nebraska and a student regent for the University of Nebraska as president of our ASUN here on campus. We have several representatives, or a couple with us from the federal delegation as well. Nate Bloom, I believe, is with us, representing Congressman Fortin, right over here. Appreciate you being here, representing the 1st Congressional District. And then a special person who's had a passion for this for some time, since he was actually a member of the Board of Regents, is Chuck Wilson. And Chuck, you're here, former member of our Board of Regents. I appreciate the support, and I know you must be very pleased to see this development here today. And we're going to have the opportunity to recognize a number of the folks who have helped make this happen, including a number of donors who are supporting the effort in augmenting the $12 million that the state of Nebraska is devoted to the new Lincoln Division of Nursing. And to start us off, I would ask you to join me in welcoming President Hank Bounds, University of Nebraska President.
Well, thank you, Chancellor, very much. Chancellor Gold, thank you for your work. Today is, I think, a really exciting day for the university. Today's really about partnerships. It's about how campuses come together to meet both the needs of the state and the needs of our students. It's I think, just incredibly exciting. And I'm pleased to talk about our donors, thanks to the philanthropic community, thanks to members of the legislature who dedicated $12 million to this effort. Brian Hastings here. Brian's worked really hard on making this project work. We'll hear from Julie Sebastian in a bit, the Dean of the College of Nursing, who is just an absolute dynamo, and I wish that we could stamp carbon copies of her and drop her all across the state. She is an amazing person. I'm so pleased that so many of my colleagues are here. And I want to recognize now some of those individuals who really helped make this project become a reality. So pleased to announce the completion of a $5.5 million private fundraising effort that was instrumental in making the project possible. I'm especially grateful to Ruth and Bill Scott, who presented the University of Nebraska Foundation with a lead challenge gift in 2014. Their desire was to encourage others to also support this effort. Ruth and Bill can't be here, but they are legendary for their support of this university. John Scott, their son, is here. John, would you stand and let us recognize you on behalf of the family? Thank you, John. Dell Lineman Sr. provided a leadership gift in association with the Lineman Charitable Trust Foundation and the Ethel S. Abbott Charitable Foundation. The gift is made in special memory of Dell's wife, Charlotte. Dell and Charlotte met while attending the University of Nebraska and married in 1944. Each of their children also attended the university. Charlotte was also a proud graduate of the UNMC College of Nursing, making this gift especially meaningful. We're pleased Dell is here today, together with several of his family members. Dell, if you would please stand, and I'd also ask your family members to please stand so that we may recognize you. Thank you very much, sir. The next folks that I would like to recommend, or recognize rather, are Dwayne and Phyllis Ackley of Lincoln, who also contributed a leadership gift. Phyllis, I know how excited Dwayne would be, and I know he's looking down right now through the, thinking about us in this cold weather, this season that we're in, and is just thrilled, as thrilled as he can be for the University of Nebraska. Dwayne, as all of you know, recently passed away in September, was a graduate of Nebraska where he received a bachelor's degree and his JD. Dwayne and Phyllis are dedicated supporters of the university and are also among the founding benefactors of the Fred and Pamela Buffett Cancer Center, currently under construction in Omaha. Phyllis, thank you so much for your continued support of our university, and I see lots of your family, so Phyllis, would you and your family members please stand and let us recognize you and thank you for your continued support of our university. Thank you. Doctors Terry and Dennis Anderson of Omaha provided a major gift in support of the nursing building. Terry is an alumna of the College of Nursing, and their gift is made in recognition of her nursing education and training at the Lincoln Division and the generations of healthcare professionals who followed in her footsteps. Dennis, and periodontist in Omaha. Dennis is a graduate of Loyola University in Chicago. We're pleased Terry could be with us today, and I would ask her to please stand so that we could recognize you, Terry. The Sharon K. Holmberg estate provided a major gift as well. Sharon Holmberg was a proud 1967 graduate of the UNMC College of Nursing. Nursing provided her with a remarkable career that included practice nursing and teaching in New York, New Hampshire, Sweden, and elsewhere. She would later serve as nursing professor at Yale University and Indiana University and the New York State University System. She passed away in 2015 in Nebraska. Please help me recognize the Sharon K. Holmberg estate. I should say that we are very pleased that Sharon's sister, Rose Castle, and Dr. Ardith Ryberg are here today in her honor, and I would like to ask Dr. Ryberg and Rose to please stand and let us recognize you. Next, I'd like to recognize Dr. David Schmidt and Marla Schmidt of Lincoln, who are longtime supporters of the university, who provided a major gift. David is an alumnus of the University of Nebraska Medical Center, where he received a Doctor of Medicine and is a radiologist in Lincoln. David and Marla were unable to be here today. However, we thank them and recognize them for their generosity. And then finally, Assurity Life Insurance Company provided a major gift as well. Assurity has made many important investments in Lincoln and in the University of Nebraska over the years, and we're certainly grateful to have their partnership with this vital project as well. Do we have anyone here representing Assurity Life? Well, let's recognize their investment in the University of Nebraska. So in just a moment, Jeff Gold, the Chancellor of the Medical Center, will come forward and talk a little bit about this project. But I don't want to go away without once again saying to our philanthropic partners, thank you. To our partners in the legislature, thank you very much. I'm excited to have two chancellors that see the value in thinking very differently about how we deliver educational services to our citizens, whether they're Nebraskans or U.S. citizens or global citizens. Jeff and Ronnie get it, and they are hyper-focused on bringing the best health care, doing the best research, providing wonderful educational opportunities. And I'd just like to maybe ask Jeff and Ronnie and Dean Sebastian to please stand for a moment, and let's recognize them for their work on this project. With that, Jeff Gold.
Thank you. Well, thank you for that great introduction, and I promise you that I will be brief. The people that have organized this wonderful event had the foresight to do it indoors. I'm guessing the ground would be rather firm today. We might break a shovel or two, and have provided me with some remarks that they would like me to stick to. But for those of you that don't know that, I'm not very good at sticking to the script, and so I actually brought my own script with me. This arrived late yesterday in my mail. For those of you that can't see it from the back, it was actually sent to me from a former patient. It says, "With love from Julie, after 22 years." Now, Julie, not Julie Sebastian, but Julie, I met when she was 2 days old, and she had very complex heart disease that she was born with, and she was operated on at 48 hours of life. And she is graduating this year from a very prominent graphic arts university on the East Coast, very close to actually where she grew up. And I was reflecting on what it is we are actually doing in this building. And what we're doing is we're educating a generation of young men and young women who will work together as a team to make sure that children like Julie have the same kind of future that this young lady is going to have. Now, unless I miss my guess, she will live a long and full and fulfilled life. And unless I miss my guess, the nurses and others that are trained and educated and have their first experiences in this building and in the hospitals and clinics of this community will help countless other patients live a long and fulfilled life. And that, ladies and gentlemen, is what makes today so extra exciting. Now, today is also about partnerships, and I can't help but call out the fact that this is, of course, a partnership between UNL and UNMC. This is a partnership between Nebraska Medicine and the University of Nebraska. This is a partnership between the public and the legislature and the private community. And by the way, thank all of our donors, benefactors who had the vision to see that this is a really critical thing to do. This is a partnership in building a workforce for tomorrow and understanding that Nebraska currently has almost 1 in 5 of all nursing positions that are unfilled. That's almost 4,000 positions across the state of Nebraska in the rural and urban communities that are unfilled. And we're committed, as we stand here today, to do our very best to fill those positions, to be sure that young women like Julie have that long and prosperous and fulfilled life. And with that, it gives me great pleasure to introduce to you Dr. Harris Frankel. Harris is a phenomenal member of this community, president of the Nebraska Medical Association, Senior Vice President of Nebraska Medicine, Chief Medical Officer, a major architect, and by the way, a very significant delegation from Nebraska Medicine is here today, and I just want to recognize you and thank you for being here, and it's an incredible pleasure to introduce Harris, and thank you so much for your partnership in this.
Thank you, Dr. Gold. Good morning, everyone. It's an honor and a privilege to stand before you this morning. I'm going to try to stay on script, but I will tell a story that does relate to my first experience as a neurology resident at UT Southwestern Parkland Hospital 30 years ago. The 8th floor at Parkland Hospital was the neuroscience unit. And my first day there, I met with the head nurse, Viola. Viola had been a 30-year veteran. Viola was sharp, she was smart, she understood teamwork. And she pulled the 5 of us first-year residents into literally a broom closet. And she looked at us and she said, "I really don't care about where you're from. I really don't care about your MD degree. What I want you to know is I'm the head nurse on this floor, and I can make you or break you." And she was right. And so I have learned all too well that our nursing colleagues are incredibly important, and they really are the ones at the front lines taking care of our patients. And Julie, the school, your graduates, your colleagues, they're tremendous. And it's a privilege to work side by side. When UNL Chancellor Perlman reached out to UNMC Chancellor Gold and Nebraska Medicine in 2014 seeking expertise in overseeing the University Health Center, there was no roadmap or template for this type of collaboration. The chancellors knew it made sense to collaborate for the good of the University of Nebraska, not only because UNMC is its sister campus and the most esteemed academic medical center in the region, but also because Nebraska Medicine has a strong reputation built on a promise of serious medicine, extraordinary care. It was the perfect partnership. What followed was a year of discovery. Nebraska Medicine researched what the University Health Center provided the UNL community and listened to what faculty, staff, and most importantly, students said they would like to see from a University Health Center. After holding focus groups, reviewing patient satisfaction surveys, and more, we devised a detailed business plan that outlined how we could enhance University Health Center services while helping the center prepare for and respond to the ever-changing healthcare landscape that we live in. Immediately after assuming management responsibilities at the health center, Nebraska Medicine put that plan into action. When the students visit the health center, they know they will receive the same high-quality healthcare services they would receive at any Nebraska Medicine world-class facility. At the same time, the health center has and will continue to maintain the unique qualities essential to serving a university population, such as its health promotion and outreach focus. Now we look to the future. In the new building, the University Health Center will remain a full-service clinic that offers a variety of services to the UNL community. Dental, counseling and psychological services, and physical therapy will all expand their footprint in the new building to accommodate the growing demand of the student population. The building will also include flexible space that can easily be arranged based on the future needs of the building. We are looking forward to collaborating with the College of Nursing in this new space. Since the beginning, UNMC and Nebraska Medicine have been proud to partner with the University of Nebraska-Lincoln in providing exceptional medical care for our students. We look forward to continuing to develop this partnership, ensuring students receive the highest quality health care possible. Thank you very much, and with that, I'd like to introduce Juan Franco, UNL Vice Chancellor of Student Affairs.
Good morning. Just delighted to be here. I am Juan Franco, Vice Chancellor for Student Affairs. And, those of us who are working directly with the students, we're having a really hard time containing our excitement about what's going on here today. At a very high level, I'm delighted that we have the opportunity to model good behavior. We've got several entities working together for the single cause of helping our students, not worried about who's going to get credit for what, simply how can we improve things for our students? And I think we're doing a delightful job of doing that, thanks to all of you. Most of my comments this morning will be related to the health center, but I also want to take the opportunity, though, to say that I'm equally excited for our nursing students. Our nursing students, deserve a place here on our main campus. And as you know, most of the students who will be taking courses in the college are really UNL students who serve the first 2 years with us. And I'm hoping that through this arrangement, they will continue to completely engaged with our campus, and we'll certainly do everything that we can to make sure that they continue to be part of us. The health center building has served us well for many years. Of late, though, however, we have frankly outgrown it, and it has stifled us in ways that we wanted to provide additional and better services for our students, but we couldn't because of the facility. What we want to do is expand our services. We want to create a center of the future, a center that our students in all Big Ten institutions can be proud of. What we want to do is focus, of course, on the basic services that we provide to any student body at any good university, but we also want to enhance preventive measures. We want to provide additional services on wellness. We want to make sure that we provide peer educators. What we want to do is make sure that we produce students who are informed consumers of health. Our goal is to keep students healthy. Certainly treat them when they come to us, but beyond that, make sure that they do what they can to make sure that they don't get sick in the first place. A very big part of that has been mentioned already is our counseling center. Our counseling center serves a really important purpose on campus, and you've probably been reading the national news. Increasingly, there's a need to provide more psychological services to our students. We are having to provide additional services. We're having to provide more people. This building is going to help us consolidate our CAPS services that we provide, but we also, in that realm, want to make sure that we provide preventive services. What we want to do is, in addition to providing the counseling services that we have been doing for many years, what we want to do is make sure that we provide training to faculty and staff to help us identify students who are experiencing extreme stress, and that we can provide them services before they have to come into the counseling center because they're experiencing very difficult situations. Now, I am delighted to say that our counseling center just received word that their internship program has just been approved by the American Psychological Association, which means that we will get a chance to help train clinicians of the future. But in addition, we get staff to help us with our students. So they're doing a lot of things. One of the things that we're asking them to do also, though, and we have to do this as a campus, we want to make sure that we improve the resiliency of our students, to improve the resiliency of our students, to be able to better handle stressful situations. As you know, our students come to us having been very well protected by their parents, which is a good thing, but when they come to us, all of a sudden, they experience this stressful situation without their parents. And so we want to make sure that they're in a position where they can respond to those stressful situations. Now, I can go on and on about how excited we are about this venture, but it's probably better that we hear from the students. We have two students that will be talking about this great enterprise that we're embarking on. Spencer Hartman is the ASUN president, and we have Harrison McMahon, who is the president of the Health Center Student Advisory Group. So why don't we show the video?
All right, so we'll check your blood pressure.
The health center is vitally important to campus, and as the student population continues to grow, the student health needs continue to grow with it. And so I think this will help meet some of those new and rising needs.
And this is going to allow us to have mental health services and primary care services all on one floor. Another area that will grow significantly is our dental clinic, and physical therapy will have about twice as much space as they have now.
Certainly excited for the partnership with the nursing college, all the donors and supporters who have come together on this, that we won't have to have a student fee increase to pay for it.
We've been very conscious to make sure that we're building for the future and that we've got flexible spaces. So if we need to change an office into an exam room or make sure that there's wireless capability throughout the entire building, we'll have that ability, and we're pretty confident we're going to be able to meet the needs of the students for many years after we're open.
The Health Center will provide the space and the opportunity to treat each student and keep them with a healthy mind and body so they can continue the important work of research and education that we as students come here to pursue.
I am Dr. Julianne Sebastian. I'm Dean of the UNMC College of Nursing, and it's just such a privilege to be with you today and to celebrate the beginning of this realization of a dream that we've had for a while now, and we're so pleased about. This new facility will be a game changer, and it is truly thanks to every one of you, our leaders, our community, and our benefactors who make this possible. And I would like to add specific thanks to Chancellor Gold, to Chancellor Green, President Bounds, and to our Board of Regents for their constant and unwavering support as we've developed the project, as we've thought the ideas through, and as we've come up with truly creative solutions. This facility that will house the Lincoln Division of the College of Nursing and the University of Nebraska-Lincoln University Health Center gives us space to allow more students to become nurses and to become faculty through our graduate programs. They will do so when we need them the most, at the bedside, in the clinics, in the homes, and in the classrooms teaching future nurses. This facility will allow us to bring on more faculty to teach these students and to conduct the research that is the bedrock of evidence-based nursing practice that we all count on and that will help us improve health in our state and beyond. The shared project will benefit both universities. It will expand collaboration, as you've heard, between two NU campuses, create more shared student experiences. It will increase educational opportunities of all types, curricular and extracurricular, and it will improve campus health options and allow for some cost savings sharing the facility, a very important consideration as we all try to aim for efficiencies and be good stewards of our funds. It will allow our students in nursing to grow and learn in a truly collegiate atmosphere where we have state-of-the-art infrastructure and technology, where we have truly interprofessional training and access, as Dr. Franco said, to all that is available at UNL, and we're very excited about that. This is what 21st century learning and discovery are all about, and we thank all of you, each of you, for making this possible. You may know that the University of Nebraska Medical Center College of Nursing Lincoln Division began in Lincoln in 1974. We were housed originally for a while in Fairfield Hall and then in Benton Hall on the city campus. And we will always be grateful to the University of Nebraska-Lincoln for being such hospitable hosts to us. By 2000, though, the facilities were getting a little bit older and we needed to do something different. Our learners needed something a little bit different. So we moved into space several years later that we leased in Commerce Court, which we have, again, appreciated very much. It's not very far away. I think some people walked here today, so not too far. But it wasn't on the college campus. It wasn't the atmosphere that we were aiming for students. And so we have been dreaming of a new facility on the UNL campus, and we are really thrilled about it. Our faculty, our staff, and our students have done amazing work over these years. We are very proud of them and their legacies, and particularly excited about celebrating some of those legacies with alums who are donors to this new facility. We look forward to a new journey with all of you as our graduates continue to fill workforce needs in Southeast Nebraska and beyond, and provide advanced degrees for future advanced practice nurses, for future faculty and nursing scientists. But I've said enough. Let's hear from our students. We have another video.
I believe the hands-on experiences early on while you're in nursing school prepare you. Now to have a whole building dedicated to nursing will just give us more space for students to work together in groups, or just give us more room to spread out and grow.
We're going to have a lot of facilities that we currently don't have for our students. We have 2 12-exam table health assessment labs down here at the end. Then we have a 12-bed skills lab in the center. Across from that are 2 40-seat classrooms. It's going to be state-of-the-art. We're going to have a simulation center in the round with 6 simulation labs that are going to have high-fidelity mannequins.
We love our location here, but to have our own space where we really can
expand on our learning and have specific things just for us is going to be so beneficial and make us such better nurses. Thank you so much. You don't know how wonderful of an opportunity this is, so thank you for making this happening. We really appreciate it.
Thank you again. I'm Brian Hastings. I'm the president and CEO of the University of Nebraska Foundation, and we had the great privilege of partnering with the university to bring this project to fruition. And Hank was kind to mention me in his opening remarks, but we have a fundamental core belief at the foundation that every employee is responsible for every gift, and we think that's a really good fundamental tenet for everybody to think about with every letter they open, with every phone call they take, and with every gift that we process, no matter how big or how small. So all of our staff really would share in the appreciation and the joy of this occasion, but every team needs a captain, and in my experience in teams that I've played on, every team needs a grinder who gets the work done. And I would be remiss if I didn't acknowledge Amy Volk, who is our Senior Vice President and who leads our UNMC fundraising team. And next to Amy, is Sarah Golden Carlson, who's now the Chief Compliance Officer at UNMC. She did such a great job on this project working with Julie and just grinded to help us bring this to completion, that Jeff Gold stole her to come over and be Chief Compliance Officer. But Sarah, you did incredible work on this too, and I want to make sure we say thank you to you. And I have the privilege of introducing representatives from each of our leadership benefactor families who helped make this possible. And I'm going to start with John Scott, who's here to represent Ruth and Bill Scott and the Ruth and Bill Scott Foundation. Simply, our university, our whole university, would not be the university that it is today without the generosity of Ruth and Bill Scott. Our state would not be what it is today without the generosity of Ruth and Bill Scott. John Scott.
It's a pleasure to be here. I don't want to be too redundant, but I think it's important to provide a donor perspective on the partnership aspects that we've got in this project. I can tell you that in the work I do on behalf of my parents, as I dialogue with my fellow peer funders in Omaha in particular, partnerships like this are really important. The aspects, the collaborative nature of projects like this, when we get people working together, it really makes a difference, and donors recognize it. So I hope that people remember that, and as we look towards the future and find ways to improve and enhance our communities and states, we keep that in mind. So I really applaud that aspect of what's going on here. Education and public health are kind of the cornerstones of my parents' philanthropy. This project was a great fit. My parents have, for some time, have believed that the challenges facing our community with the nursing shortage and the appropriate nurses that teach our new students is a challenge that needed to be met, and I think we've come a long way. I know from personal experience how important nurses are to health. I think one of our prior speakers called them our front line. I was thinking of them as our offensive line, but maybe front line's a more appropriate way to think about that. My parents couldn't be here today, but I wanted to tell you, lest anybody think that they're absentee donors and not concerned about this project, I will share with you that my mom, when she was first shown the renderings for this facility, immediately called Amy Volk and Julie to say that the yellow furniture in the lobby had to go. We weren't going to have yellow furniture in a University of Nebraska-Lincoln facility. So I want you to know they're paying attention. They look forward to coming back for the dedication, and I'm sure it'll be great. Thank you.
A few weeks ago, I had the privilege of coming over to the Lineman family office, and I had a chance, Del, to see a lot of your archives. Chip brought me around and shared stories about your family and about your career. and about your charitable work and all that you've done in the state. And it's a really great Nebraska story. You have a really great University of Nebraska family, and we're delighted to have Doug represent the family here today and share a few remarks.
Well, we're very pleased to be here, very pleased to be part of this entire project. Our family's been very blessed, and we're very fortunate. And part of that, a large part of that, is the foundation we all received here at the University of Nebraska. It's a foundation that prepares you for life to take advantage of the opportunities that come your way. It's also kind of generational. My mother, we made the donation in my mother's name, Charlotte Peck Lineman. She graduated in the 40s. My sister, the next generation, she graduated from the nursing college in Diane Carpenter. She's in Denver, Colorado. And that's our second generation. And then our third generation, we just had Dr. Elizabeth Flug graduate. So it's a generational experience for our family with the medical center and all that, the wonderful things that the university does and provides. So thank you. I will mention that the fourth generation is only 8 years away from coming to university, so don't screw it up.
Thank you, Doug. And last but certainly not least, to represent Dwayne and Phyllis Ackley and the Ackley family is Phyllis's son-in-law, Ton Ostergaard, who's also a member of our foundation board and one of the first families that I had a chance to get to know and meet. And they have just the amount of time, effort, and support that you put into the university and that you put into the community, what your company and Dwayne's company have done for the workforce and the economy in the state. It's really, really amazing. So, Ton.
Well, thank you, Brian. That's very nice of you. Again, on behalf of Dwayne and Phyllis and our family, it's just a real pleasure to be here today. Dwayne and Phyllis have long been huge supporters of the medical community within the state and the university and our community here in Lincoln. And so this is just a great project to have a further extension of the University of Nebraska Med Center here in Lincoln. And it's just a real pleasure and honor to be a part of this project. You know, I want to just reflect a little bit as a one-time patient at the Med Center, or at the, I should say, at the Student Health Center. That is a very important place for those students when you're away from home, away from family, and if you become sick, you need a place to go, and you're a little scared. I would say jokingly in those days, 30-some years ago, it was called student death. I don't think that was a fair name for it, but nonetheless, the care you got there was very, very important. And I would just like to ask all those professionals from the Student Health Center to please stand and be recognized, because this building is really for you. I'd also like to just recognize the importance of nursing, and Dr. Frankel said it very, very well, but all of us that have ever been in the care at a hospital know that the nurse is really that bedside that makes it all better, makes it feel better. Sometimes softens the message that the doctor has to deliver, but it's a great team. And the nurses are really, as both John said as well, the front line, the offensive line that really makes that care the quality that it is. So this is a great project for both the health center and the School of Nursing, and just want to say thank you and our pleasure to be a part of it. All the best.
Thank you, Ton. Could I just ask to ask everybody to share another round of applause for our leadership benefactors, but for all of the people who helped make this project, from the planners to all of the donors, to everybody who was involved with it. Could we just give a nice round of applause for all of them? And as I close my remarks, we want to say thanks again to the state and to the legislature. This was a wonderful public-private partnership to bring this project to fruition. And I think in this holiday season and spirit of Thanksgiving, and to piggyback on your remarks, Tom, if you just think about what this means long-term and the compassion that nurses and healthcare providers share on a daily basis for us and all of our families and all of our friends. There's probably not a more fitting project to end this year with in terms of building in a new beginning because of what this means long-term for the care and all the compassion that will come from that. So a housekeeping item, following the event, we're going to ask each contributor and their family with we have a small memento for you, and we would like to ask you to join us in the back here in the conference room for a photo opportunity as well. Chancellor Green.
Well, I think you can see from all of the descriptions about the beauty of this partnership and the way that it's come together that this will not only be a building and the location that the building will be, but it will be a beacon of hope, and a beacon of hope for our university, for our state, and for this very important area in healthcare. So thanks again to all who have made it happen, to our support in the state, our support in the university, the two campuses, the teams that have come together to make that happen. Now, I do have just a few key people to recognize before we check the score here pretty quickly. First of all, Hausman Construction is doing the construction work that has already started on the site. If you've been by, you know it started in this past month with the groundwork. We're very excited to be working with Hausman on another project here on our campus. They're also finishing our College of Business Administration building project at this point. Our architects, Allie Pointer is here, I think. Hopefully Allie's here in the back. From Macchietto Architects and HGA Architects. And then another example of the partnership here is that our two facilities teams, both from UNL and UNMC, have worked jointly together in planning this project. So I'd like for you to give them all a big round of applause for making this happen. So thanks for being here. It's a great day in Nebraska. Go Big Red.